Today on Highlighting the MP, I have colleague Keydella Fuller, who is a nurse practitioner and a functional medicine health consultant. So today we're just going to learn more about functional medicine. It's been booming right now in healthcare. So welcome, Keydella. Thank you for joining us today.
Thanks for having me again, Karen.
I know, part two. So last time I interviewed Keydella Fuller in the summer of 2022, and we just talked about her role as a cardiology nurse practitioner. But today we're just going to talk about her role as a functional medicine health consultant. So thank you again, Keydella, for your time. So let's just get into it. So tell us, what is a functional medicine?
So, functional medicine often kind of similar to holistic medicine, and a lot of people confuse the two. And we utilize a lot of the similar principles. You looking at the whole body and treating and implementing things for the whole body as opposed to the specific area or symptom individually. We do a lot of lifestyle and food as medicine, and not just supplements, take this supplement for that, this supplement for that, but really work on getting to the root cause as to why these things are happening. I believe that these imbalances that occur in the body is what kind of leads to these diagnoses or symptoms that a lot of people experience. However, in traditional medicine, we do a really good job of focusing on this particular symptom. So, like if you have diabetes, we treat your diabetes. If you have high blood pressure, we treat your high blood pressure. If you have seizures or migraines, we focus on that as opposed to looking at you as a whole person, a whole being, encompassing mind, body, soul, spirit, everything in one is kind of how we look at you through the functional medicine lens.
Awesome. Yeah, because you know me, I have migraines. So it's, when I have a migraine, I have pain. Then I don't feel like doing anything. I want to be in bed all day. So I guess with, seeing you as a functional medicine consultant, instead of just focusing on my headaches, you would focus on my whole body, how it affects me. That's what I'm hearing,
Yeah,
correct?
we would focus on Karen and what's going on in Karen's life, Karen's environment, her lifestyle, her diet that could be negatively impacting your genes. And these symptoms are being expressed as migraines.
Makes sense. Makes sense. So what inspired you to become a functional medicine health consultant?
So I had been in medicine for like 10 years and had no idea that this whole other part of medicine existed. It wasn't until I myself got frustrated with the traditional medicine system trying to find answers for my husband. I'm always the one helping other people, putting everyone else before me, treating myself last. So here it was trying to find answers for my husband's chronic fatigue and ADD symptoms. We went to see specialist after specialist, doctor after doctor, blood work, everything comes back as normal. He's fine. One doctor even went as far as calling him the pillar of health on paper because everything was just like perfect. And I'm like, no, he's not, because I have to wake up at 5 a.m., push him out the bed, give him some Adderall so he has the energy to get up and start his day. That's not normal, right? So in my research, I found functional medicine and kind of took a deep dive into that, learning everything that I could. And after a few weeks of implementing a plan that I put together for him, he said, it's getting a little bit easier to wake up in the morning. And right there, like that moment is kind of when I was just like, wow, like there's got to be other people out there who need help like this, because I'm a nurse practitioner, been a nurse for 8 years, helping so many people at the hospital, saving how many lives, and I couldn't even help my husband until this one little thing. And it's just a matter of looking at things differently. So fast forward, during my training, I had to do some labs on myself. And during that time, I realized, oh, snap, I got my own issues that I need to work on too. Like while I was focusing on taking care of everybody else, I noticed I was ignoring myself. I was becoming one of my cardiac patients. My blood pressure was fine, but my blood cholesterol numbers were starting to go up. My blood sugars were starting to go up. And I was like, okay, this is not good. I'm going to become a cardiac patient, knowing how that cycle goes. So it was then that I realized that I needed to prioritize my health as well, because if I'm not well, how can I be there for all the other people that I'm so worried about, you know? And that's kind of how I started this functional medicine journey and started my business.
Thank you for sharing that story. Health is wealth for sure. Um,
Yes.
did you take any courses to become a functional medicine health consultant?
Of course, yes. So, this functional medicine and alternative medicine and holistic care is not something that we really learn. Even nutrition, we don't really learn much about it in school. So, I took a functional medicine program, and that was taught by Institute of Functional Medicine practitioner. And I also took some other courses through another functional medicine school called School of Applied Functional Medicine, and also took some other side courses just to learn more on deeper, like a deep dive in other specific topics. And then I took a hair tissue mineral analysis course.
And what's the average cost for a program for functional medicine?
So I think it depends, right? You have to look at each program and figure out what are they truly offering. Is it just like an introductory into functional medicine, or is it like a path to certification for functional medicine? So a lot of providers out there open up their own training programs, and that might go for a couple $1,000s. If you go through a more reputable school like School of Applied Functional Medicine or IFM, you're looking about eight to $10,000 and more, depending on the school. Um,
Thank you for that knowledge. So please tell us about your business, Fuller Health and Wellness. When did you open and what services do you offer?
so I opened late 2021, and it's a virtual health consulting business. I help women improve their health so they look and feel their best. Well, I have worked with some men before, so I do see some men also, but I focus primarily on women. I also focus on gut health because about 80 to 90% of what's going on is stemming from the gut. Hippocrates is known for saying all disease begins in the gut. And while not maybe all of them do, science is showing maybe 80 to 90% of them do. So if we can just make some simple changes with the gut health, how we're eating and digesting our food, that can be such a big improvement for some people. So when we focus on really what's going on, the root cause, everything else falls into place. Into that comes hormone balancing and weight loss and mental health, physical health, mindset. So all of these things kind of come together. I do have a business partner. We run a weight loss program together called Reset with KK. So that's also been really successful. And our patients are telling us, like they can do this now. They know, and they know the tools, what to do, what not to do, that they feel confident that the weight that they've lost with us, they're able to maintain it. And then they can also continue and do another weight loss cycle if that's what they choose.
Awesome. Thank you. And what marketing strategies do you utilize to get clients?
So word of mouth has been really big for me, getting referrals from you and other providers, as well as other clients that I've worked with, sending people into my space or people that I know on social media. They're sending people to me that are talking to them about having certain symptoms or complaints about certain conditions. I do so post some videos and educational content on my social media platforms, doing some webinars and workshops online and some local workshops here just to again get my face out there, get my name out there, and networking events with some colleagues or wellness conferences, wellness events, summits, and working on putting my own summit together actually.
Oh, nice. When will that be?
More to come on that one. It
But
takes a lot of work to put the summit together, like getting all the speakers involved, and yeah, it takes a lot.
sure, I'm looking forward to that. Please share your Instagram and Facebook page with us.
Oh, yeah. So it's just my name, Keydella Fuller, Key, D as in David, Fuller, and that's across all platforms.
Awesome. And what are the pros and cons of being a functional medicine health consultant?
Yes. So time, I would say, is a pro and a con. So time is a big one because it is challenging to go through, because we are so much more comprehensive, we go deeper. So our intake process is a little bit longer, I guess, for both the client and the practitioner, because there's a lot more forms to fill out, more history, to get really what's going on. So that takes some time to go through, as well as a functional medicine visit can easily last 60 to 90 minutes just because we go that deep in figuring out what's going on. So some clients are love that because they're like, "Hey, I never spent this much time with my provider before." They're usually in and out before I can even say everything that I have to say. Other people are not really used to it, so that's something that we kind of have to work with and maybe break up into shorter visits. But yeah, time is a big one. Also, I think another con for some clients is like having a quick fix, like especially in the weight loss era with all of these injections that are going around now. And it's like, you do this, you lose like so much weight in such a short amount of time. So we don't necessarily believe in quick fixes. We do have some quick relief options available that we can get you feeling better right away, but we're still working in the background to figure out what's going on. So we don't need to rely on these quick fixes in the long run. You know what I mean? And then the other big challenge I would say is cost, right? Because a lot of, say, testing that we order aren't approved through insurances, and a lot of functional medicine providers do not accept insurance. So it's primarily out of pocket or cash pay. Some have the option to use like their HSA
Okay, that's
like insurance card. So you can do that for some health consulting services or paying certain labs and supplements. But I would say cost is a big issue. But on the flip side to that, like we were talking before about your health being your wealth, like you have to put yourself over the money, right? Because um, at the end of the day, like what really matters, a lot of practitioners do upsell their labs and supplements. So, they buy it like wholesale and sell it to you at a higher price. With us, we really strive to make it affordable for everyone so that everyone should have access to care and feel like they're getting good care and actually feel better. So we only order labs when they're absolutely necessary, certain functional medicine labs. I'm looking for a cost effective way to help people. And that's where my hair tissue mineral analysis comes in. It really gives me a lot of data up front, and that can further guide whether like functional medicine labs are truly necessary. So we can kind of curb the cost on that a little bit.
Tell us about this hair tissue sample analysis.
Yeah, so you take a sample of your hair. It's not a lot, probably about a teaspoon worth of hair. We send it to the lab, they analyze your hair. So when we're looking at the hair strands, our minerals are released in a specific pattern. Sometimes we are supposed to see some minerals in the hair and some minerals we're not supposed to see. So we look at each mineral by themselves, and then we also look at the ratios of each mineral to kind of let you know, okay, what is your actual mineral vitamin requirement? Are you taking way too much magnesium and you need to cut back a little bit? Are you overdoing it with the zinc? Because it's supposed to be a balance in the body, right? So in the body, everything has kind of like a position. Certain things can knock these minerals out of position. A lot of that is being heavy metals, it's like toxicity in the body can knock these vitamins and displace these vitamins and minerals in the body. So we're able to pick all of that up on the hair tissue mineral analysis. We're able to pick up how's your adrenal health going based on what your sodium and potassium ratios look like from how it's distributed in your hair. We can look and see how your thyroid function is doing, how your bone health is doing, how your gut health is doing, how your immune health is doing. And so it gives us a lot of info on this really affordable test.
Oh, that's good to know from a hairpiece. Awesome. Yeah, because I remember I was telling you, like, I have a lot of patients who are taking like multiple supplements, ashwagandha, vitamin C, vitamin B12, magnesium glycinate. So
Hmm.
that's good to know. So you're teaching me stuff that I never knew.
Yeah. So, and that's what functional medicine will do. It's like, wow, I never knew this. And why did I not know this? I should have been taught this in school, right? But that's medicine. You always have to be learning. It's a always learning situation and field that we're in.
Awesome. And then any more pros at all?
Oh, yes. So time again, being a pro, I like to see time as a pro because I can really sit and get to know the person that I'm working with and really personalize whatever recommendations it is that I'm giving to them. Because if I know you have XYZ going on, I have to kind of be realistic with what it is that I'm trying to offer to you. Because if I do too much, then you might look at me like I got three heads. And sometimes some people might be ready to do a lot more. So kind of meeting people where they are, and that time aspect really helps kind of put things in perspective. We get truly comprehensive with what's going on, like I mentioned before, and not just the surface. We dig deep into the roots to see what's kind of going on and driving these symptoms. And then we see you as a person. We focus on all of the other areas of your life, of your health, not just what you're eating and if you're exercising, but what's your environment like? What kind of products are you using in your hair, on your skin that can also be impacting your health? Um, what other pros do we have here? Personalized care, like I was saying before with the hair tissue mineral analysis, we can really personalize lifestyle interventions as well as supplement needs. So we know we're not over supplementing with certain vitamins because we can do more harm than good.
Mhm. Less is more sometimes. Yes.
Yes, less is more sometimes. And we really try to focus on food as medicine. So just making some small dietary changes can be super impactful.
So what's like a fruit that you would recommend?
A food.
Or yeah, a food or fruit. Yeah.
Oh, so, well, since I focus on gut health, I say add some fermented foods into your diet. So things like sauerkraut, kimchi, these things help to increase the amount of bacteria in our gut. And prebiotic foods like onions, garlics, leeks, jicama, they help to feed the good bacteria, right? So probiotics kind of give more bacteria, and prebiotics help to feed the bacteria. So I would give you that tip.
Thank you for sharing. And then
Yes,
my last question is, what advice would you give to those interested in specializing in functional medicine?
go for it. There's a big need out there, and just even having some basic education on lifestyle and nutrition can be super impactful. And I utilize both every day, lifestyle and nutrition. Even when I'm dealing with my cardiology clients, like my functional medicine training is coming in there as I try to fit it in 5 minutes. But find a school that is going to provide what you need, right? So you got to do your research and find a good school and see the curriculum and make sure the school is actually going to show you how to implement all of the knowledge and tools that you're going to get, how to implement it in everyday client scenarios. And I would also say, as my last tip, to get comfortable with asking why. Go deeper into your questioning, deeper than what you normally do in traditional medicine. Ask why, and then ask why again and again and again until you kind of get to the root cause. Because a lot of times on the surface, especially some clients will kind of give you some bogus answer. And then you go a little bit deeper till you kind of get that emotional response to whatever the question is, whether it is why they want to improve their health or why they want to lose weight. Or it sounds kind of silly saying it, but kind of making an emotional connection with the reason that they're here or the reason they want to get better really helps put things in perspective for the client and the provider.
Interesting. Oh, yes. Why? Why? Well, thank you, Keydella. Thank you so much for your time today. I greatly appreciate it. Thank you.
Thanks for having me, Karen.
Thank you.